Good morning, everyone. Thanks for joining us on another edition of the CWA's Community Calls. We're excited to have Pat and Bix from the Headwall Group here with us to talk about returning to youth programming in the time of COVID-19. So just a few housekeeping items. We will be using a few features of Zoom, so I want to just direct your attention to the middle center of your bottom center of your screen, where we have the Q&A, the chat, and the raise hand features. As questions pop into your head throughout the call today, make sure you put those in the Q&A box. And then if somebody else has a question that is the same as yours, you can actually upvote those and they'll rise to the top of the list. We've already got a great chat going. Thanks to everybody who's letting us know where they're calling in from and what gyms they work for. We've got folks from all over the country and all over the world, actually, which is pretty cool. And finally, once we get to the Q&A portion of the call, if you'd like to raise your hand and speak live on the call, you can use the raise hand feature to ask a question out loud, or make a comment, add your 2 cents. And then the ground rules, as always, just to be polite and respectful of each other and of our panelists. No personal political commentary. And if you do raise your hand to speak on the call, please try to limit your comments to 2 minutes. And if we have any issues with those rules, we have the ability to remove participants. So with that, I'm going to hand it over to Garnet, who is just going to speak a little bit on a situation that has come up over the past few days in California.
Hey, Laura, thanks. So unfortunately, we have a new legislative challenge coming up in California. And we're lucky to have on the call with us as well Scott Andrews from the ACCT, who's working on this. But wanted to make you guys aware of it. You might have seen it in the email announcement for this community call. And you also might have seen it on Facebook and other social media posts. We have a news article on it on our website. But basically, there's a new definition of camps that's surfaced and up for a vote soon in California. And it's a pretty wide sweeping piece of legislation that will pretty much impact any gym that offers services to youth in an organized fashion anyway, not so much just walk-in families or anything like that. Some of the key provisions in there that just wanted to bring your guys' attention to are things like additional licensing fees, annual building inspections, a bunch of problematic rules around some of the, I guess, most alarming ones might be around CPR and first aid certifications and their validity and expiry periods. But if you are in California, or if you work for a vendor who manufactures products that are widely used by California gyms, your voice also is really relevant in this matter, because it could affect those gyms' need for some of your equipment. So if you're in California right now, or a vendor selling into California, definitely take time to click through. And if you move to the next slide, Laura, definitely take time to click through, read our article that we have around how this might affect climbing gyms, and consider and do get in contact with your state senator or California state senators. We've got some lookup tools in that news article that we've posted. And you can also really quickly register as a to submit an electronic position letter in California. That's their preferred method of receiving this kind of communication. It's a very timely matter. It'd be great to get any comments to California by July 8th. So if you have the time to do that, yeah, please take a quick review of the situation there, and make your voice heard. Yeah, so if you're unmuted, Scott, if you have anything you'd like to add to that, it'd be great to hear from you.
Garnet, I think you've got it covered pretty well there. I mean, the timeliness of this, there is only about 12 days left in the period that's available for comment on this piece of legislation. It is being pushed really hard by very small group of people out of Southern California. And it's aimed initially at the organized camp community, and the intention being to increase safety at camps, but it's not headed in the right direction, and really strongly recommend folks reach out to your representatives or senators, your assembly person or your senator if you're in California, or if you're doing business in California, to reach out through the portal as well. And the portal is actually the way that those letters get electronically tallied, and the information gets spread to a lot of people more quickly. But we do think the notification of your assembly person is key, because this will come up for a vote first in the assembly and then go back to the Senate for confirmation if it's going to move forward. And we hope that it won't, and that the camp community in California can move forward with its efforts to create safer and more inclusive regulation of camps without impacting the climbing wall community, because this would definitely be a negative impact on folks.
Yeah, thanks very much for that, Scott. And yeah, just to reiterate, a lot of the language says things like camps, and you might think, well, maybe in my gym I don't offer a summer camp, although many, many of you do. But the way that this bill is written, it will affect literally anyone who deals with kids, karate classes even. So, if you have a youth climbing team, if you offer group learn to lead classes or outdoor excursions, anything like that, you probably would be swept up under this bill. So yeah, thanks for letting us hijack your presentation a little bit, Laura, Bix, and Pat. And let's kick off with what you guys have prepared.
Yeah, no problem. It's an important thing. So help us spread the word to all of the gyms in California who might be impacted by this, to make their voices heard. Thanks, Garnet and Scott. So moving on to our presentation from the Headwall Group. The Headwall Group is a consulting and training agency that uses the principles of experiential education to help organizations build the capacity of their teams and improve the quality of their program delivery. Their expertise includes youth programming, facilitation, and instruction. They've been conference presenters and workshop facilitators at the CWA Summit and CWA meetings for several years, and we're really excited to have them here today to help us address some of the issues that are facing the industry, specifically around youth programming, summer camps, and teams in the time of COVID-19. So with that, I'll hand it over to Bix and Pat.
Awesome, thank you, Laura. Yeah, as Bix is kind of sharing his screen to pull up our, there we go, our PowerPoint. Yeah, I just wanted to introduce myself. I'm Pat. I live in Denver, and I've been, like Laura said, I'm one part of the Headwall Group, and we provide training and consulting services for youth serving organizations. We've worked with summer camps, schools, teachers, and lots of climbing coaches, just to provide guidance and services related to curriculum development and program implementation and facilitation. Bix and I have been working together for many years and have been partnered with the Headwall Group, or have created this partnership for about 4 years, and probably have met quite a few of you along the way. And definitely bummed we can't get to see you all this year more in person, but very grateful that we were invited here to be panelists today for this discussion. So I'll pass it over to Bix to kind of introduce himself and get started.
Yeah, so I'm Bix Spear. I'm based up in Boise, Idaho. Like Pat said, we've been working together for a little over a decade, running outdoor education and experiential education programming, training staff, and then, yeah, about 4 or 5 years ago, started the Headwall Group to fill a need we saw, which was to provide some professional development and capacity building for programs that work with young people. And I'm really excited that we found a way to keep interacting with you all, even in this time where we can't be together in person. So to dive right into it, today we're going to be running through some considerations and then some very specific strategies for reopening youth programming. Before we do that, though, we felt like we just needed to run through the process that has to happen before making the decision to run these programs. We know you are all professionals. We know you are all doing this internally. but it will lay the foundation for the rest of what we're going to discuss in this webinar. So obviously, we all know by now, following local health expert recommendations is the most important thing. What we're seeing just across the board with youth programs is summer camps and some school programs chose, despite recommendations not to this summer, to dive into programming. Those that didn't follow local recommendations are all already closing down. So being aware of what's going on in your area and responding to the changing recommendations of health experts is super key. It's also, and we're seeing with folks we work with, a little less of this, but it's really important to understand and be able to articulate your own business's risk tolerance, and if that risk tolerance is different for different populations. What we mean by that is when dealing with young people, they have less agency about being there. So it might behoove us to be a little more conservative about exposing them than it would members who are making the choice to come into your business. Really important to consider why you are doing what you are doing. So why have you limited the capacity to the point you have, and can you justify continuing to do that with youth programs, or would you even have to lower the capacity? Masks, understanding that young people, especially at the younger end of the spectrum, have trouble keeping those on. So if that's your way you're justifying opening, are young people going to do it? And if they're not, can you still keep folks safe? Things like locker rooms, limited hours, limiting areas, all the things you're already doing as business owners or program managers. You need to reevaluate these once you're considering bringing younger folks into the fold. And then once you've decided to reopen youth programs, considering all these things, the recommendations that we're going to share are going to become more. So what's unique? Youth programs depend on staff being super hands-on with young people. Young people might not know how to tie themselves in. They're more likely to get hurt or need comforting in a way that would bring you in close contact with them. They're more used to being facilitated to in a way that would bring you in very close contact with them. So how will you keep your staff safe in doing that? And do you have the capacity in your gym to run programs that are meaningful to young people while keeping your staff safe? The other thing that's really important to consider here is that young folks just do not social distance. If your reopening of youth programs is dependent on the idea that young climbers will keep distance from each other, that should not, you should not be reopening youth programs. What we're seeing across the board with youth programs is that it's impossible to maintain social distance. So other risk mitigation techniques need to be what you're incorporating more so. Hygiene concerns are unique. You know, young folks, especially at the younger end of the spectrum, don't understand the hygiene consequences of their decisions, touch their faces a lot, don't wash their hands as much as they should, and we really need to be able to monitor those things. Teams and camps to be both fiscally solvent and socially work well for their participants require larger groups than are often recommended. Young climbers are more likely to share equipment. And one of the things we hear most about with working with gyms is that strategies are needed to sort of manage youth climber and adult member interactions. And those interactions have the potential to become more challenging in the current climate. The first thing that I think is the most important strategy to reopening youth programming is not directly program related, but it's communication related. So you need to over communicate with membership. You need to over communicate with families, staff, and participants. But in communicating, you need to have limited information that remains consistent. So you need to determine what's most important to communicate. One of those things is being realistic about risk. That allows your members and families to determine their own risk tolerance and determine whether it's really feasible for them and their families to participate in your programs. That's going to mean that as you continue to grow your capacity to run programs, people are going to trust you, see that you're reevaluating your decisions, and be more likely to enroll their students or re-enroll their young climbers later. So communicating about that risk, it's important to do your who, what, why, and how. So who are you communicating to and what's the important information there? So if you're communicating with families, you're going to be communicating about how you're going to be keeping their young people safe. The what really focuses on that safety part and the justification that you're still going to meet your climbing goals or your social goals of your program, which is the why. And then the how is you need to have specific strategies that are realistic for keeping young climbers safe if families are going to feel confident enrolling their students into it. If you can't open all of those questions, or if you can't answer all of those questions openly, it's really important to come back to the first step of that and determine if you're ready to run programs. Being consistent, so rules and guidelines for members have to be the same across all programs. We've been seeing that here where I live a little bit with programs that are being run in public areas with young people who aren't following all the same rules, and it's been creating some real tension around using the same space. Knowing what your organizational guidelines are and having them very visible for everybody. So what makes it safe to run programs? What makes it safe to be open? And when will you be reevaluating that? Are you reevaluating these decisions only if your local health authorities change the phase of reopening that you're in? Are you as a leadership team reevaluating after the first program you run? This is essential to communicate everybody involved, staff, families, young people, and general membership, because this will give them confidence that their safety is being taken seriously, but it will also create sort of a scaffold for you to determine how you as an individual unit can reopen. So like we said, all the communication has to adjust how the decision that youth programming would occur was decided, and what those metrics are, how they'll be reevaluated. Community expectations. When communicating with youth and family, it's going to become really important that health-related practices also have consequences associated with them in the way any rule in youth programming would. When decisions will be reevaluated, and what your risk mitigation techniques are. Once again, those risk mitigation techniques need to be things you can actually do. So rather than saying, we're going to keep our young climbers 6 feet apart, you need to think about what you as a staff can actually do to mitigate risk. And be aware of your pre-existing youth and adult member dynamics. Make sure that you're able to keep everyone feeling like you have their safety in mind. Let you take it over here, Pat.
Yeah, awesome. So all of that kind of leads up to, you know, as you're making your decision to reopen as a gym, and then to reopen your youth programming, there's like a lot of logistics involved to think about and to consider, especially as they relate to youth programming, and understanding those and your ability to manage those is really going to determine your path forward and how you're going to open your program. So we kind of wanted to just go through a list of some considerations that are unique to, that might actually not be unique to youth programming, but are important to youth programming. And before I jump in, just know that this isn't necessarily an exhaustive list of logistical considerations that you might need to make when thinking about reopening your youth program, but kind of a jumping off point in some topics that we've heard are of kind of the biggest concerns among folks in youth programming with climbing right now. First of all, hygiene is, you know, obviously a big issue, especially with kiddos. Hand washing and hand sanitizing is not an easy thing to make sure kids are doing the appropriate frequency. Face touching is pretty common. Kids are constantly bringing their hands to their face, to their mouth, things like that. And in an environment like a climbing gym where pretty much every surface is a high touch surface, that presents a considerable challenge. Kids are always coughing and sneezing without covering their mouths, things like that, which has been proven to be, you know, obviously a big factor for the spreading of this virus. So that's obviously a huge issue. And kind of like what Bix brought up earlier, if your organization's expectation is that all members and staff are wearing masks while in the facility, then it's reasonable to expect that of the kiddos as well. And it's important to consider if that's a realistic possibility for you as a coach and a coaching staff to kind of enforce with your kiddos. Kind of as we're going through these two, we'll kind of share a few just basic programming implementation ideas that can sort of try to address some of this stuff. But just know that we'll go into some of that more in depth in a little bit as well. For hygiene, an idea that we came up with that we've used a lot in our youth programming that we've done are accountability buddies. So for hygiene, pairing students up to make sure that they're taking responsibility for their and each other's personal hygiene related to the virus during practice. That puts some of the responsibility into the group and starts to fold that into the culture a little bit, as well as giving the coaching staff kind of an easier way to monitor this by doing frequent check-ins. And instead of just being responsible for themselves, they're responsible for a teammate as well. Grouping is another issue that we've heard a lot of concern around. Like Bix was saying, something unique to climbing teams is that unlike with your basic membership base where you can kind of limit sizes and enforce social distancing a little better, by definition, climbing teams are larger groups of kids and adults interacting with each other in close quarters. So thinking about ways to manage that. Some of the thoughts that Bix and I had around this are like reducing group sizes or creating cohorts within your team so that you can more easily separate groups and space activities out a bit. Designated areas kind of play into this as well as you're thinking about planning, which is something we'll talk about in a minute as well. Thinking about where your team members are going to practice relative to general members and adults. Are there spaces that can be designated for team use only? This is obviously a kind of a hot button topic with most teams just because of limited space in the gym and the high demand for space during the times that teams are usually practicing. But now more than ever, it's probably important to really come to a decision on how those spaces are going to be used during coaching hours and team hours. And then, gym hours, if there's a possibility to do team only hours or youth only times, things like that. We realize that that's probably not a possibility for every facility, but thinking about those things, if that's the only way that you can keep your team, your kiddos, your staff safe, then maybe it's something to consider.
To jump in real quick, Pat, on the idea of cohorts too. What it seems to be happening and what we're seeing, both recommendations from like the American Camp Association, but also what workplaces are discovering, is if you can knit together a cohort that stays fairly separate from other cohorts in a workplace or in a camp, the chance of spread is really small in those groups of 4 to 5. The second you're getting bigger than that or combining those and having them interact, moving kids around, moving staff around, you have a much higher chance of exposing people. So the best you can keep a small impermeable cohort matched with the same staff, the safer you're going to be keeping everybody. So I think that's number one strategy to consider.
Yeah, awesome. Thank you. Mm-hmm. You want to jump on over? Another concern we've heard a lot is related to equipment. Like Bix was saying earlier, teams share equipment quite a bit, and there's a lot of shared equipment, shared touched items throughout a practice or a summer camp or a season. Rental gear, holds, ropes, training tools, things like that. So I think what a lot of this comes down to is going to be identifying what your organization's policy is and then finding ways to implement that policy in your team. So for example, maybe rental gear isn't being used at your facility for that reason. An idea that we had is maybe if your facility has the resources to do so, assigning youth their own rental equipment for the duration of the camp or the season even, so that they're the only ones using that particular piece of equipment. Could be a challenge for facilities with limited rental equipment, but something to consider. It's probably not super reasonable to expect all families to send kiddos with their own equipment, but those climbers that are able to bring their own equipment, requiring that rather than rental gear could be a way to go. Climbing holds and just areas in the gym, again, make sure that you're on par with your organization's policy. How frequently are the holds being cleaned? Is there a gym area rotation system happening? And if so, how are you going to message that to your team, to your climbers, and to your coaches? And to really message the importance of not climbing in certain areas if those areas are closed to your kiddos. Ropes, is another issue we've heard a lot of concern around, especially lead ropes that experience a lot of handling during climbing. And, a lot of gyms lend those out. So what is your organization's policy regarding lead ropes? And again, there's the added risk factor of lead ropes being put in the climber's mouth when they're clipping and things. So that's, just another thing to consider. Training tools like hangboards and weight room equipment, campus boards, things like that. If some of your, more competitive climbers are using those things on a regular basis as part of their training programs, you need to basically mitigate that risk and make a plan to make sure that you're not putting your climbers at risk using those things. So maybe that's hangboards are, washed more frequently. Or maybe that means that some of this type of training, is put on pause until the risk has been reduced a bit.
Well, the program I currently run in our climbing space, any shared equipment just gets a 3-day break in between users. So we date everything with masking tape, and it doesn't go back into rotation with my students until it's had 3 days off, which is imperfect, and there's mixed messaging about, but it's definitely a technique to try to mitigate community spread.
Cool, yeah, so if you want to jump into that next one, this all kind of leads to, considering all that, like, what do you do now? Like, how do you implement programming with all of these things to consider? First of all, just to reiterate, that wasn't an exhaustive list of things to consider, and taking certain precautions is not necessarily a surefire way to reduce the spread. So again, referring back to your local health agencies' recommendations and requirements is going to be key. And like Vic said at the beginning, constant reevaluation of the practices you're putting into place is going to be super important throughout this time. And then again, communicating those things to your families and to your staff. But once things are rolling and it's been deemed safe enough to continue, like, what do you do? How do you plan for your programming in light of all these restrictions and precautions that need to be taken? Something Bix and I talk about a lot with the climbing coaches that we work with in general, not relating to planning around COVID, but is extremely relevant and practical here, is how you set goals and then plan towards them. So this is a great time to reevaluate your program's goals. And first of all, consider what they are. And then in light of all the precautions and restrictions that need to be put into place, determining whether those goals, that those explicitly stated goals of your program, can be met under these new conditions. And if the answer is no, I think there's kind of two routes you can go, which is make the decision that now is not the right time to move forward with your youth program, because you won't be able to make steps towards your goals without putting people at risk. So that's not, an appropriate time to go forward with your program. Or adapt your goals and change your goals to meet the to become realistic and realistically attainable under the conditions that you're going to operate your program. Once you've done that and you've revisited your goals and you've made them explicit and you've decided that you're going to move forward in an attempt to reach those goals, planning becomes a huge, basically the most important next step. And when you think about planning, when you're planning around implementing your program in this time of COVID-19, it's not unlike planning any other time, and anticipating the challenges that are going to occur. So the first thing we want to talk about with planning is incorporating a risk management plan in every single step of your program. And we've kind of broken this down into three main categories that we think are important. What is the environmental risk of this activity? Do I have the space to do this activity safely, basically? What is the equipment risk? Is the equipment needed going to cause a health risk to the people engaged in the activity? And what is the social risk? Is just this activity inherently too big a group or too small a space to be successful and safe? Bix, do you want to elaborate on those at all before we move on?
Yeah, absolutely. So I think really what you're looking at is my space going to increase my participants' risk more than just coming into this gym? Is the equipment usage or sharing, those sorts of logistical parts of this activity, this lesson plan, going to increase my participants' risk more than coming into climb? And am I encouraging people to take social risks with distancing, with interacting with large groups, with interacting with different members in a way that's going to increase their risk beyond just coming into climb? All lesson planning needs to ask those three questions, and then be reflective enough to modify in ways we'll talk about to take care of your participants so it doesn't increase their risk beyond just coming into climb.
Yeah, awesome. Yeah, thank you. And so, it's a lot of work, but it's really important, and will not only help your program as a whole, but it will help you, guide your coaches in doing the things that they need to do to implement the program safely. When you're thinking about planning too, and you're thinking about these considerations, whether it's hygiene or increased social distancing or decreased group sizes, things like that, think about that as you're planning your program, and think about how you can build these new expectations into your culture so they don't just become kind of rules that are imposed on your kiddos and your staff, but just something that is an expectation of the group and part of the culture of the organization. So for example, maybe this would be a good time to kind of reevaluate your team's group norms, your social contracts that you have with your staff and your students, and add into those expectations that reflect the logistic safety considerations that you've already thought about and discussed with your management team. An example that comes to mind with this is like one thing that we think about a lot when we work with climbing coaches. A big issue that we hear a lot is like behavior issues in transition times. And so for example, if you're warming up with a group of 8 to 12-year-olds, and then it's time to move over to the bouldering area, and the coach says, all right, everybody, I'll meet you in the bouldering area in 5 minutes. And there isn't much expectation around that transition. That's when we see a lot of behavior issues. So what we usually teach is to write essentially every minute of the practice into your plan so that you can anticipate issues like that. we think that that would be a good plan and a good idea here to do with all of these health and safety issues too. So maybe you write a hygiene activity into your program specifically. So you might say, you know, everybody ask a friend what they did this weekend, wash your hands for 20 seconds, then meet in the bouldering area in X amount of time. So actually writing that into your plan so that you're not having to think too much about it or waste too much time during your practice because you hadn't considered it beforehand. So preparation is super important, I think, with addressing the concerns of all these logistical health issues. Yeah, and then that kind of moves into like, what does it look like to actually modify your programming? Bix is going to talk a little bit more about this, but I'll just start by kind of saying, you know, think about what you can do. First of all, similar to how like the workforce is operating now, is there things you can do to add value to the program remotely with your kiddos? Can you still run your program with either not in person or less frequent in person programming? So maybe that looks like your coaches writing training plans for some of your competitive climbers that they can engage in at home. Or maybe it's breaking your teams into smaller cohorts. So maybe you have a team that meets Monday, Wednesday, Friday. Maybe those teams get broken into thirds, and then each cohort practices only once a week in person and then has some assigned additional supplemental training that they can do at home that the coach can kind of follow through on. But that's kind of a good place to start, seeing like, what can you do without interacting in person? Bix, I'll pass it over to you to kind of elaborate a little more on some of this stuff.
Yeah, absolutely. So I think the first thing, like Pat said, when we're modifying our programming is really to look at how to de-densify it, right? Once you've already considered that, we've already talked about this a little, but limiting shared equipment during activities is going to be something that's going to go a long way to protecting your young climbers. That includes like considering lead climbing exercises, how to do that without passing back and forth ropes. We often encourage folks who are working on footwork or working on climbing more slabby things to use different props that force your climbers to touch them or interact with them, limiting that and finding new creative ways to monitor from a distance with sight or sound as opposed to with equipment. And then training equipment, seeing how you can design trainings for your young climbers that don't have them using shared training areas. That creates, I think, a larger exposure for your general membership as well as your young climbers. The other thing is staggering and limiting people using areas. So a couple good activities that we like to use in busy gyms where having your whole team together doesn't make sense are to play add-on, but using stations around the gym monitored by program staff or coaches. So you don't have a large group in one place. You're limiting how much time everyone's spending in a small area, and you're keeping people rotating through. Another one that we like to do is team points. All of these games we can share with participants who are interested if they email us through a resource we've developed. But basically creating small cohorts or pairs that move around the gym, monitoring each other's progress throughout the activity rather than having to keep the large group together. Modifying games and activities. So as much as we said we didn't want to use props that were shared, we can use some facilitation tools or props in a way that reminds young climbers about distancing and about staying safe. We've been a big fan of using tag games on walls. They keep folks engaged. They keep people on the wall. They allow us to monitor a larger group at once. But incorporating things like pool noodles or other props that give a visual identification for distance is a great way to modify games for a small group in this time. Also, verbal and visual safety checks for your team can be incorporated. You know, we all know how we teach belaying, but there's no reason that we can't have similar safety checks, not around the belay check, but at other times, for hygiene practices, for masks, for staying with your group. There's ways to create rituals around keeping each other safe, just like we do with the technical aspects of climbing. Finally, creating spaces of learning is something that Pat and I talk a lot about when we train facilitators, that young people respond to the same area in the same way. So if we're teaching, we should usually be trying to do that in the same shape or in the same area, because that will be a cue to our young climbers that they need to be listening to us, right? If there's free time, that shouldn't happen in the same area that you give instruction in, because that will create mixed messages about what to do in that space. What we can do is use that same principle to encourage safe practices during facilitation and during games. So having an instruction zone or a turn waiting zone that's distanced from where other membership or other folks will be using the gym. If possible, designating part of a parking lot or another outside space for any group time or instructional time. What we're discovering is that dilution is the solution to pollution, and that holds true with COVID from everything we've seen. So having any of that instructional time, if possible, be in the biggest areas possible or outside, and visually marking top rope tie-in areas and belay zones, because there's a real tendency to get very close to each other in that time, since we're used to handling each other's knots, physically checking each other's harnesses. This is something that program staff can do visually, and we can make sure to distance our climber when they're doing those things. We have a lot of other ideas for these activities that we don't have time to share today specifically, but we're happy to share with your programs individually if you care to reach out to us. And that's our contact information. And we're running a little late here, but happy to start taking questions.
Thanks, Pat and Bix. That was awesome. It gave everyone a lot of great things to think about and an awesome framework to use as they're going through the process of making decisions about restarting their programs. So folks, feel free to put any questions that you have in the Q&A box. We'll just start with one here from John. Going back to one of the logistical questions that you had, he is asking, what are gyms doing for cleaning holds? I know you mentioned it's up to each organization and the policies they have in place, but can you provide some examples you have heard? And actually, Garnet, I wonder if you would want to speak to this one, since you've been working with the route setting committee.
Sure. Yeah. As you mentioned in the comments there, we do have a relatively extensive guide in our reopening guidance on how to handle hold cleaning. One of the most fundamental strategies that came up when we were discussing that is the ability to quarantine holds for a certain amount of time. Not extremely good data on what the right amount of time is, but if you want to be extra safe, a week should be good, and that's in line with CDC and WHO guidance for cleaning of facilities in general. So just removing the holds from the wall, letting them sit in a bucket or a bin for a week, maybe 3 days at a minimum, would be a great strategy. You can also soak holds in either a bleach solution. You can find instructions on how to make that bleach solution from the CDC website and our reopening guidance. And even just a regular non-detergent dish soap is a great thing to soak holds in as well. Just pay attention to the amount of time needed for any of those various cleaning chemicals, and you can find a lot of resources around for that. As you go about looking at those things, one of the things to keep in mind is just workplace safety. So definitely take a look through our route setting guidance on different strategies you can put in place for stripping holds from the walls, as that is one of the most potentially infectious areas or high risk activities when it comes to actually cleaning holds prior to doing a soak or any sort of quarantine process. So there's some great guidance there, and Laura had provided those links in the chat, so you guys can just click through directly to that.
Awesome. Thanks, Garnet. We've got another great question here from Jesse, who's asking if you can tell us more about the hygiene accountability buddies and how you're able to integrate that into the norms of the group.
I think one of the most important steps with any group of youth at any time is creating a group or social contract for your young climbers, for your program participants to be a part of. Those contracts should include standards that are important to your organization or your program, as well as things that are important to the participants. And that needs to be something that's created at the beginning of a session, whether that's a camp session or a team season. That also needs to be something that can be visible and referred to by your program staff, whether that's something they carry on a clipboard, a poster that's posted at the beginning of practice, something like that. So just as you as a coach or program manager might include in that group contract something along the lines of, we show up on time to practice, or we stay through the whole practice. You would be able to incorporate your program standards for hygiene into that document. So it might be, we wash our hands before every route we climb, or we sanitize our hands before that. And this works especially well for the younger age spectrum, probably like 8 to 12, would be assigning each participant an accountability buddy who they report out on how well each other have followed those norms around hygiene. So whether that's wearing a mask, hand washing, not touching your face, not eating during practice, whatever things might be different. And there's various ways to have these accountability buddies report back. One is just verbal check-ins consistently, the same way you would about progress and training. But there's also ways to have like report cards that folks would fill out on each other, or check boxes when they see somebody do something good. We always encourage program staff to check in by asking what they've seen the other person do successfully. So when today did you see your accountability buddy follow our hygiene rules? How did they do that? Could you highlight? What that ends up doing is monitoring your participants for good and normalizing those behaviors as just part of how you all behave together, the same way you would when folks are encouraging each other when they're climbing. Pat, do you have any other thoughts on that?
Yeah, I think it's something, that type of those types of relationships is something we usually teach to build into your programs anyway, and it creates a really easy way for coaches to debrief certain activities as well. And this is just another kind of way to incorporate something that kind of already exists as a tool for facilitation, and applying it to these new things that we need to consider regarding hygiene. And yeah, so like Vic said, you can do verbal check-ins and things like that, but it's a really good tool if you're at a loss for what to talk about during a debrief. It's really easy to just say, somebody tell me something they saw their accountability buddy do that reflects this particular group norm, right? And that way you don't have to spend a ton of time going through and holding each person accountable. Put some of that responsibility and that agency on the participants.
Yeah, that makes a lot of sense, because at first, one of the things that came to mind for me was the possibility of that turning into like an opportunity for kids to basically tattletale on each other, right? And so turning that around a little bit and making it more about reinforcing, positive reinforcement makes a lot of sense. Have you had any issues with kids taking it towards the like tattletale kind of way? I don't know.
In my experience, if we create group contracts that are only positives, which is hard for a lot of youth workers who are used to monitoring for negative behavior, but if we're looking at assets rather than deficits in behavior, students, young people reflect that. So rather than saying like, we won't be disrespectful, we won't insult people, it's about supporting people using respectful language. Your participants will mirror that approach to it.
Yeah, it's part of that kind of integrated system of positive reinforcement, and it comes from positive language and group norms and rules. It comes from like what you're expected to do, not what not to do, and that's kind of how we talk about behaviors and things like that. And then and also modeled from coaches is a really big way to like modeling as a coach is a really good way to kind of steer that away from a more accusatory kind of thing and more of a supportive, positive outlook on what your partner's doing. But yeah, that's a good point.
Gotcha. Awesome. All right, so we've got another question here in the Q&A box. It's an interesting and oddly specific question that this person has gotten from parents who are disgruntled about the requirement to wear masks. They claim it impairs the ability for their child to execute good technique and therefore devalues the program if they're unable to overcome this. How would you respond to this?
Well, first, I think it's really important for Pat and I to say we're not business owners of a gym, right? So we don't have to make the financial decisions that affect how we're reopening. But I think like the question to me would be, is it more important that the gym stays open based on safety practices, even if it might impair your students or your child's performance, or that they don't wear a mask? And I think most people, you know, when given the opportunity, my child will climb or they won't get to climb, would choose the route towards that. I know there was a great blog post on the CWA about managing member conflict about these things that I think would be worth looking at for that as well. Yeah.
Awesome. Well, it looks like we have responded to all the questions, so we'll just give a second here.
One more question while we're waiting to see if anyone has any last things to ask Pat and Bix. You touched on the idea of cohorting and maybe changing group sizes. When it comes to like the raw numbers, that's always a hard one, as you said, to make from the financial standpoint as well. But like, what are some group sizes that you would imagine would work well, both like the smallest and the biggest number for some of the strategies that you proposed today?
I think that okay, from a safety perspective, the information we've gotten is that cohorts of 4 to 5 are where that safety margin really starts to change. So 4 to 5 seem like a healthy number to have in a small cohort working together with limited chance of community spread. That's the most important thing. I think that what Pat and I have discovered as far as programming goes, and Pat, I'd be curious to hear this, is that a group of 4 to 5 is really the smallest you can do a lot of meaningful group activities with that don't just become individual activities. So that seems like it would be the sweet spot of balancing program efficacy with safety of participants. I think the other thing to consider is that you might have many more young climbers there than 4 to 5, right? But they might be rotating through activities in that small cohort. So the lesson planning is the same across that broad group of, say, 20 groups, or 20 that's divided into 4 or 5 groups of 4 or 5 climbers. So it doesn't actually increase staff needs, assuming we're having about 1 staff to 5 people, which seems fairly common in programs. So it's a way to manage that fiscally and programmatically.
Great.
Yeah, I agree with that. Yeah. Yeah, I mean, when we facilitate programs, 4 people, any less than 4 can be challenging for certain types of group activities, obviously. But 4 to 5, totally reasonable from a programmatic standpoint. Yeah.
And I think for most of the games we have in our climbing games resource could be done very effectively with 4 or 5 young people.
Yep.
Great, thanks guys. Well, it looks like we don't have any more questions. So Garnet, if you want to go ahead and close us out, that'd be great.
Yeah, you bet. So yeah, just wanted to remind you guys, we are doing these community calls and webinars weekly. As we touched on some of the a little bit earlier today, but we're going to have a panel discussion with the CWA's route setting committee around reopening guidance and really any other questions you guys might have for route setters in these times. So we got a great team of people that are going to be on that call. That'll be coming up next Tuesday, July 14th at 10 a.m. As always. And we'll keep you posted for what our future webinars will be as well. So definitely, stay tuned for that and mention that content to the route setters on your team and have them sit in on the call. As always, we'll be recording these and placing them on our website and YouTube as well, so they can revisit this content later and get all of that info from Pat and Bix into your entire coaching team. You can always also reach out to anyone here at the CWA directly. We are there for you all times of the day, especially via email. So just let us know what your needs are, and we'll help you find out any answers that we can. I'm going to do one last little plug for that Senate bill in California. If any of you out there are in California and want to chat about it, definitely feel free to get in touch with me or anyone at the CWA staff, and we can help you create your position letters and get in touch with your state representatives. And yeah, last, just to close us out, thank you guys again for all of your time on these calls and all of your expertise. Thanks to Pat and Bix for helping us out here and sharing their wisdom. And we'll see you next Tuesday. Have a great week.
Thanks for having us.
Thanks.
Thanks for having us.
Thanks, guys.